Hi everyone, welcome to ResearchMD.com. Another great presentation. We've been doing a series of lectures on antibiotics. Now it's another topic. I'm going to, again, let me introduce myself. My name is Dr. Pramil Chariat. I'm a program director in internal medicine residency, transitional residency. I teach medical students and residents on a regular basis, also an associate professor of medicine to a large medical school. So now let's go back to our topic, antibiotic again. Today we're going to look let's say we got a patient in the outpatient setting, right? Got a urinary tract infection. What happens? You do some blood work, you find out the patient has a urinary tract infection, they're symptomatic, maybe a little bit of elevation in the white blood cell count. And usually what they do, we just prescribe oral antibiotic, take the antibiotic, you get better, you forget about it, right? Let's say if you're admitting a patient in the hospital, is having fever, is tachycardia, systemic inflammatory response syndrome, and the WBC is elevated. What do? You start the patient on antibiotic. Before you start the patient on antibiotic, we do culture and sensitivity, right? It could be blood, it could be the wound, it could be urine, anywhere there's a fluid, you take the fluid and send it out. You hear the term, let's do culture and sensitivity. For easy, let's take the blood. So we drew blood, mainly like 2 places, and then we send it to the lab for culture and sensitivity. So what happens in the culture? You get the culture results, and they will say something like, okay, we identified gram positive, then or gram negative, and then 1 day later or 2 days later, they identify the organism. They will say Staph aureus, or they may say Streptococcus. They may say E. coli. So you will get that report, right? And then it may take a couple of days or 1 day later. Once you get the culture identification, we look at the sensitivity. We need to know which antibiotic is going to work on them. That's what we're trying to find out. That's why this thing comes into play. Okay, 2 terms we need to know. We'll start with the MIC. The term is the minimum inhibitory concentration. Okay, MIC, remember that. There's another term, this called MBC, which is the minimum bactericidal concentration. Okay, and now let's define what MIC is. Is the minimum concentration of antibiotic that prevent bacterial growth. Okay, very, very important. You need to know. When you're a patient in the hospital, you need to know that. So that is a minimum concentration of antibiotic that prevent bacterial growth. Now, let's look at the second term, which is MBC, which is a minimum bactericidal concentration. So what is MBC? Minimum concentration of antibiotic that kills the bacteria. Okay, that is bactericidal, is killing the bacteria. Now, so you send the results to the lab, you get a chart, come back and say like, oh wow, they put like a lot of antibiotic up here, you put the antibiotic name, and you got MIC, minimum inhibitory concentration, there's an interpretation, S or SI, things like that. We'll come back to that. This is what we need to know. How do you interpret that? Why is it important to us, right? We need to identify the bacteria, and we need to find out what's the specific drug could destroy that organism, right? That's where this comes into play. So before we get into that, there's a couple of terms we need to know. And first thing we need to do is get 1, 2, 3, 4, 5, 6, 7, 8. We get 8 test tubes, okay? And then you put the drug in dilutions in there. Right? You look at the dilution, 0.12, 0.25, 0.5, 1, 2, 4, all these are dilutions. And then you put same amount of bacteria in each one of them, you deposit. Okay? See what happens at 0.5, you inhibit the bacterial growth. So that is the minimum concentration of antibiotic that prevent the bacterial growth. So it is inhibited. Okay? Then so there is something called a break point. Anytime if you use anything above, let's look at the definition first. What is a break point? Highest plasma concentration of drug that can safely be, look at the word safely, that's what I want you to remember, safely be achieved in a patient to define susceptibility of an organism. Okay, so you have to be careful. This is all inhibit the growth. Okay, when you come up here, more than 3 is the break point here. If you use more than at this concentration, that'd be like a lot of complication to patient. You can have side effects. You don't want to do that. Now we have to look at some of the terms we have to know. One is called susceptibility. So first thing you will see S right here. Okay, S equals to S. You can use it. Susceptible. What is susceptible? MIC less than the breakpoint. So MIC is right here and this breakpoint is over here. So what is the MIC? It's less than the breakpoint. So you can go ahead and use it, save. Okay. Now, the next thing is the intermediate, MIC approaching at the breakpoint. The MIC come up here. 0.5 did not inhibit the growth. 1 did not inhibit the growth. 2 did not inhibit the growth. Up here, it comes an inhibitor. So what happened? Your MIC is equals to breakpoint. That is called intermediate. Okay, in that case, it may be or may not be effective, but it can be effective if you use a better, bigger dose. Okay. Now remember, the last one is the resistant R. Don't use it. Okay, because it's not going to work. What does that mean? MIC greater than the breakpoint. What is the MIC is going to be? MIC is going to keep on going. The breakpoint is right here. MIC don't use in that circumstance. So it's resistant. It's not going to work. Okay. So you got this S, R, S, 1, I, intermediate, susceptible, resistant, susceptible, intermediate, susceptible. Okay, so you can use this drug. You can use aztreonam, you can use cefepime, you can use gentamicin, you can use meropenem, you can use zosyn or piperacillin tazobactam. All these have like susceptible. Okay. When you use ciprofloxacin, is the intermediate. That means MIC equal to the break point. Okay, you may need a bigger dose. Now, where do you get this break point? Like, how do you get the numbers? The break point over here is 3, right? How do you know that? You can Google search it. The lab, it's a specific lab set value. It's kind of remains constant. So aztreonam may be like 4, ciprofloxacin be 2 or 3. You can just Google search it, you can find it. Okay. The first thing you wanted to do, if you want to really go into it, what you need to do, find the break point. Now, if a drug is a break point, let's say the break point 88 and MIC is over here, that's a safe drug. Okay. So dilutions below the break point. So the more distance from the break point and the MIC, that's good. Okay, that give you a lot of safety. You feel safe about using that drug. Let's say MIC is right here and the break point is right here. There's only a little bit distance between that. You have to be careful because you have a tiny window before you go into safety complications. Okay. So dilutions below the break point, we just have to kind of look at it. Now you got 3 drugs over here. You got meropenem, you got gentamicin, you got aztreonam. All these are susceptible. So what's the best way you can see like that? Don't compare the MIC. Don't look at the MIC. Say just use that drug. MIC no, do not. The mistake people make is like don't compare MIC. Get it out of your brain. What you have to do is look at the break point and compare to MIC. Okay, so you Google search it, find out the break point. Let's say meropenem. Let's compare meropenem and gentamicin. Okay, so meropenem is 0.5 up here, right? Then I look at the break point. If the break point is 2 for meropenem, and then if you take gentamicin, okay, and the break point gentamicin may be like 16, there's a big difference between MIC and the break point, then I take the drug. Okay, then I take the gentamicin. Okay, so that's what important. You have to look at the break point, and the wider the window from break point to MIC, that is good for you to use it. Don't compare it, otherwise people make the mistake all the time. They compare the MIC. Do not do that. Okay, look at the break point and look at the MIC. The further you are away from the MIC, from the break point, that give you like a lot of safety profile. It's a good drug to use. Okay, thank you so much for watching. We'll be back with another presentation soon. God bless. Please subscribe to our channel.